Institute for Indian Mother and Child is a non-governmental organization operating in the Indian state of West Bengal. More than 50% of the people living in West Bengal are illiterate, and millions are living below the poverty level.
IIMC, Institute for Indian Mother and Child, was born in 1989, especially with the idea to help the poorest of the poor Indian people.
Dr. Sujit founded the institute due to the need for medical help in West Bengal. It started with just one small clinic. Today, 700 people are working full-time for the institute. In order to make lasting improvement in the lives of the people, IIMC has gone further than medicine alone. The institute aims to help people out of poverty through three main programs: education of children, empowerment of women, healthcare program. Education of children.
When we started our project, we started only with medical support for the poor children. But our doctors' realization that many children and their family, they can read and write the prescription. And the children are coming, most of the children are not sick because they have no idea about hygiene, about virus, bacteria. Every week they came with the same problem and doctors, they just repeated with the same medicine. So it doesn't help to our society. We think if we want to change our society, if we want to help our poor section, we have to educate our children first.
To ensure that children from poor families get educated, IIMC has started an educational sponsorship program. Today, over 3,000 children are sponsored by IIMC. The idea is to send at least one child from a family to school, so that he or she can learn to read and write.
One child from one family should be educated. He or she can help our family, they can help others also. Like this way, our society can develop. And we are very successful among our sponsored children. 50% girls, they are studying in university.
The lack of school facilities in the rural areas, together with the increasing numbers of sponsored children, has led to the need for the IIMC to build schools around West Bengal.
We have built 26 schools now in different rural areas. 9 to 10,000 families will get one educated child, and they will take care of the family because education empowers the people. Education shows the pathway to the people.
Empowerment of women. In the rural areas, the child mortality is high. Many children are dying from diarrhea and other common diseases in the arms of their mothers. Around 80% of all these diseases can be prevented by providing the mothers with knowledge about health and hygiene and give them the strength and possibility to act in the community. To empower the women, IIMC has implemented 3 initiatives: the Network Program, to educate the women; the Microcredit Program, to help them financially; the Women's Peace Council, to develop them socially and culturally.
Women plays a very important role in family. She is the main pivot of a family. She runs the family from morning to night. So if we can educate a woman, the whole family will be educated. When some village is coming under our IIMC's network service, we first select 3 local girls or women from the village. We take them in the indoor and we educate them about health and hygiene and how to talk with the village people. These health workers, after getting training from IIMC, go to the villages and talk to the especially village mothers about their health and hygiene.
Empowering the women is important in developing the small communities and the rural areas. If the women can play a more important role in the communities, they can contribute to the social and economic development. IIMC have succeeded in helping the women to become self-sufficient through microcredit loans.
A lot of people are living below poverty level, no? They need small money, small loan for small business. Because our poor people, they have a dream, but they are not getting any support from other people, other bank, government bank and any other organization, no? Small loan can help them to improve themselves. Small business like a vegetable shop, vegetable cultivation, fish cultivation, fish selling, and spice business, small garments, lot of business.
More than 25,000 women are taking part in the microcredit program, and almost everyone, 98%, pay their loans back. To develop women socially and culturally, IIMC has started the Women's Peace Council as the third part of the Women's Empowerment Program.
Peace Council is another women empowerment program after microfinance. It works in this way. We have selected some mothers and we have formed one group in each village with 10 members. There are many problems in the villages like family quarreling, girl-child's marriage. These types of many social problems are in the villages. We help the members to identify the problems, and when they are aware of these problems, they go to there and try to solve the problems peacefully.
The IIMC Peace Council is working successfully in more than 300 villages. The healthcare program. The public medical service is not reaching the poorest people in West Bengal. To meet this problem, IIMC has built 8 outdoor and 2 indoor medical clinics. The outdoor clinics are placed in rural areas where they are needed most. The indoor clinics have 40 beds where patients can have long-term treatment.
We go our main outdoor twice in a day, Monday and Thursday. We are covered different type of diseases, lots of doctors, 12 doctors working, different unit also, general unit, gynecology, dental, eye, homeopathy. Lots of patients is coming, more than 800 to 1,000 patients per day. And also men, women, children, everybody is coming to the outdoor. So because they are very much neglected, the poorest of the poor people. Always coming poorest of the poor people. We have see always poorest of the, not middle class, not upper class.
We really use this health mission for 2 purposes. First, definitely to help them when they are very sick, they have no support from a local area, from the governments. So we send them some health service. At the same time, through the health service, we can approach our empowerment program. IIMC is really a very good institute where national and international support and participation is working very fruitfully together. We receive lot of international volunteers. They are coming, they are really giving directly hand, helping the people. They are also kind of our motivational, inspirational resource, because when these volunteers are coming, our local volunteers are very stimulated and inspired.
The international volunteers play an important role in the project, and for many volunteers, being at the IIMC is a valuable experience both professionally and personally.
So from a personal point of view, it's a very rewarding experience. We get to, I guess, interact with a group of people who would otherwise not really have any sort of access to healthcare or anything like that. And I think the best thing from my point of view is that everyone's just so grateful just to receive anything, if it's just a wound dressing or even just a vaccination. They really appreciate what you do here, and it's really nice just to get involved and to, I mean, not really make a huge difference, but just a little difference.
Together with the international volunteers, IIMC is trying to make a difference for the poor people in West Bengal. IIMC can hopefully inspire others to make a difference in other parts of India. You can help, sponsor a child, be a volunteer, or support IIMC financially. Read more on iimcmissioncal.org.